federal agencies will investigate whether antidepressants are fueling violent behavior.
At NIH, we're launching studies on the potential contribution of some of the SSRI drugs and some of the other psychiatric drugs that might be contributing to violence. You know, many of them on there have black box warnings that warn of suicidal ideation and homicidal ideation. So we can't exclude those as a culprit, and those are the kind of studies that we're doing.
Antidepressants have seen a whopping 66% increase in prescription rates for adolescents and young adults between the years of 2016 and 2022 in the United States. This is according to the American Academy of Pediatrics. The question this study raises is that what effect do antidepressant drugs have on kids and their developing brains and systems? Is the SSRI drug doing more harm than good? That is the question the shooting in Minneapolis has sparked. That's the question HHS Secretary Kennedy seeks to answer. The reaction has been immediate. Democrats and their allies in academia say Kennedy is stigmatizing mental health patients and dodging the real issue of gun access. So there we go, back to the gun conversation. Stanford psychiatrist Keith Humphreys told Axios the focus on SSRIs is, quote, a distraction. And Minnesota Senator Tina Smith went further, blasting Kennedy's remarks as BS and offensive to grieving families. The New York Post reports Kennedy is also probing whether transition medications taken by the Minneapolis shooter should be examined, a line of inquiry Democrats and LGBTQ activists have predictably condemned as scapegoating. Joining us now is child and adolescent psychiatrist Dr. Mark McDonald. Dr. McDonald, thank you for joining us. Why this shocking 66% increase in antidepressant prescriptions to America's kids? What's going on there?
Well, that's actually a very simple question to answer. And the answer is American children are more anxious and more depressed than they've ever been. And we are not actually finding out why and treating it appropriately. And so the most simple, economical, and efficient way to quote unquote treat this is to prescribe an antidepressant like Zoloft or Prozac.
So talk to us about what effects this is supposed to have on the good side and what side effects are possible on the negatives.
Well, I am not a big fan of prescription drugs for children in most cases. And if you look at the studies, it's a coin toss in most cases whether or not these drugs actually reduce anxiety and depression. But they are largely benign. There isn't really a lot of evidence that shows that there are long-term negative side effects for these drugs. There are some studies that show perhaps permanent sexual dysfunction, but that's arguable. There's no weight gain or sleep issues with these drugs. They don't slow down cognition. They're not addictive. They don't cause weight gain. So most doctors want to prescribe the least offensive drug that they can, and that's why they choose SSRIs.
That said, on the black box, you have some antidepressants where the black box warnings include warnings that it could result in suicidal or violent thoughts. That seems to be a giant red flag, especially for kids who are already emotionally in need of something.
It is a red flag, but it's actually more of a red herring. These studies that were performed on the SSRIs decades ago did not actually find any increased risk of completed suicide or even attempted suicide. What they found was an increased risk of what's called self-harm. And that could be, for example, a child picking up a pencil and stabbing him in the hand with the tip of the pencil lead, which is physically abusive, but it's not suicidal. And there's no increased risk of loss of life with these drugs. And I believe that RFK Jr., someone I strongly support in most positions on food safety and health and medicine, is incorrect when he says that there are black box homicidal warnings for Zoloft, Prozac, Lexapro, etc. I don't believe that's the case. I've never seen one, and I've seen no evidence to show that children or even young adults who are on those drugs are at an increased risk of harming other people or killing them.